Good afternoon to all the teachers and students. I, Arpita Khandekar and Zaida Khan, first year MSc Nursing students, welcome you all for the national webinar planned today on the topic of patient safety highest priority. Your presence is appreciated for this webinar. We will start the workshop immediately after the welcome song. Lamplight.
अर्पिता म्यूट कर दो।
So here I would like to call my colleague Ms. Zaida Khan to carry forward the webinar. So a very good afternoon to all the teachers and the students who are present here. So we will start the webinar. We will start with a brief introduction about the webinar. So patient safety is one of the key components of the health services. Patient safety related error includes such as medication errors, hospital infections, patient falls and bed sores. Effective patient safety is related to lowering the rate of the patient's complication and fewer adverse events. Then patient safety is a culture whereby nurses are aware of the errors and are encouraged to discuss among them. This is in turn improves their ability to learn from the past mistakes and take the corrective measures in the future. So the basic aim of this webinar is the webinar actually focuses to ensure that the patient safety is institutionalized as a fundamental principle of the healthcare delivery system in improving the health outcomes. The objectives of the webinar are: first, it is to understand essential components of the patient safety in hospital. Second, to recognize the various types of errors in the hospital. Then third, to provide clear priorities and strategies for improving the patient safety. So he is one of our colleague, Mr. Snell Alvarez. He is a first year MSc student who will be leading to the opener of the theme. Hereby, I would like to call Mr. Snell Alvarez, who will be the opener of the theme. And he will be taking the opening to the existing presentation. Over to you, Snell.
Good afternoon and welcome everyone for today's national webinar. I am Mr. Snell Alvarez, first year MSc Nursing student of MGM New Bombay College of Nursing. I am honored and absolutely privileged to speak in front of you all and initiate the proceedings with opening of theme patient safety highest priority. Thank you everyone for taking out your valuable time and being here today on this platform. First and foremost, I would like to offer my sincere gratitude and thank our director, principal, professional, Professor Dr. Prabhakar Desila ma'am, Vice Principal Dr. R. Ponchitra, Mrs. Susan Jacob ma'am, Program Coordinator, and all my teachers for providing me extremely useful and enlightening opportunity to open the theme for today's webinar. The alarming rise in morbidity and mortality among hospitalized patients throughout the world concern about professional competence. Nurses and other healthcare professionals are under scrutiny to provide safe and effective care. In this light, it becomes an extreme necessity that future nurses who will graduate are capable of providing safe patient care. Evidence-based practice has shown the increasingly growing magnitude of patient safety concern in various reports, and it's our obligation to gain knowledge of our ways to make healthcare system safer. So in response to the highest priority of patient safety, we all have joined this webinar to ensure that the patient safety is institutionalized as fundamental principle of the healthcare delivery system in improving health outcomes. Today, we are going to have 4 enthusiastic sessions of deliberation by 4 eminent expert speakers, and for today's webinar, we are going to cover certain objectives. The first objective is going to be to understand fundamental of patient safety and its component, in which the main focus will be on whose safety is compromised and various factors responsible to ensure effective and safe patient care. The second objective that we are going to cover is to recognize the various type of errors in healthcare system, because patients can be harmed from healthcare system or resulting in, and that can result in permanent injury, increased length of stay in the hospital, and even death. Adverse event occur not because people intentionally hurt patients, but rather due to complexity of healthcare system, where treatment and care depends on many factors in addition to the competence of healthcare providers, difficulty in recognizing errors, lack of information system to identify the errors, shortage of clinical professionals, and other system factors and human factors contributing in patient safety. The third objective that we are going to cover, that is to identify emerging challenges and provide strategies to improve patient safety. In these, emphasis will be mainly on to determine the current challenges faced by healthcare workers, like detection of error, reporting, blame culture, defensiveness and secrecy, and reduction and mitigation of unsafe acts within the healthcare system, as well as through the use of best practices to lead optimal patient outcomes and responsibilities of governing bodies to enhance patient safety and implementation of international patient safety code. The last objective that this webinar set is to understand the role of every healthcare team members in patient safety. As a healthcare team member, what are the individual level and group level responsibilities as each member in ensuring safe patient care and positive outcomes. So as a, once a wise man said, when we take something as problem, we become a part of problem. And when we take something as challenge, we become a part of challenge. So today we have the most dynamic speaker for today is first speaker, and the first session will be covered. That is a fundamental of patient safety by most dynamic speaker, that is Dr. Padmaja Dhavale madam. The second session, today we have among us our own charismatic speaker, Mrs. Sarika Nair ma'am. She will deliberate on the second session, that is type of error in healthcare system. The third and most important session of emerging challenges and strategies to improve patient safety will be deliberated by the eloquent and dynamic speaker, Mrs. Suparna Patil ma'am. Then fourth and last session, the role of healthcare team members in patient safety, will be preached by very distinguished inspirational speaker, Dr. Jyoti Chaudhary ma'am. And I again extend my warm welcome to everyone who could make it to join this webinar today. And I'm confident that at end of this webinar, you will all leave charged with a deep sense of feeling of patient safety in terms of safe environment and safe care. Thank you.
Thank you very much, Mr. Snell Alvarez, for that wonderful opening of the webinar. That was very useful and it brings out some interest in knowing about this webinar more. So now I would like to welcome the reputed Dr. Padmaja Pramod Dhavale. She is an associate professor and a nursing superintendent at the MGM New Bombay College of Nursing. The professional qualifications are she has done JNM from the School of Nursing, Parel, in the year of 1993. Then BSc Nursing from Wellness Hospital, Meerut Sangli, Nasik in the year of 2001, and she has completed her MSc in Pediatric Nursing from MGM Bombay Hospital. And she has also done her PhD in Pediatric Nursing from MGM IHS Navi Mumbai in the year of 2021. So as my colleague has already told that she will be dealing with the session 1, which is fundamental of patient safety and its component. So here I welcome Dr. Padmaja Pramod Dhavale ma'am to continue the session.
I would like to thank the College of Nursing for giving me an opportunity to communicate with all of them regarding the fundamentals of patient care. Secondly, we all have gathered here to know about the patient safety. I would like to welcome all the participants, those who are attending this webinar, and would like to say thank for the organizing members, like MSc students, they have organized this webinar. So let us start with the topic. The topic is fundamentals of nursing, fundamentals of patient safety. Now in this fundamentals of patient safety, we have seen that the patients, those who are getting admitted in any of the healthcare setting, they just hand over themselves to the hospital or the healthcare setting for getting all right or for recovery from their diseases. But the thing is happening that whenever they get admitted as a patient, they don't just excuse me. Good afternoon. Yeah, as we have seen that many of the patients, they approach healthcare setting for their survival or to get recover from their illness. And to help the patient or to save the patient, we cannot guarantee that there won't be any harm. So they are at risk of getting harm from the healthcare setting, even though they have got admitted for the recovery from the illness. So it should not happen that the patients, they develop some other problem. Why it is happening? Because many a times we have seen that since last 15 years, it has been recognized and observed that due to the complexity of the healthcare services and the healthcare facilities or the new advancement in the technology, these healthcare people or healthcare personnel and their competency, which is not getting along with. So there is a challenge for dealing with the complex healthcare setting with the complexity of their competency. There are chances of patients getting harm from the healthcare services. Now, what is to be done? Why it is happening? Because as we have seen that in healthcare setting, there are many healthcare professionals like dietitians, doctors, dentists, there are nurses, midwives, there are even the diagnostic centers where the technicians are also dealing, there are even physiotherapists. So many healthcare professionals are involved in the patient care. So we can say that we are providing a intercollaborative care to the patient. But these many people, when they are providing a care, it is very unsure to say that the patient is safe. So the patient safety is at challenge. So let us see why and at a global level when we see this. Just a minute, the screen is. So when we say that every year we have observed as per the WHO data what it has been given, every year millions of patients suffer injuries or die because of unsafe and poor healthcare. Now previously patients even they were admitted in the hospital, they were treated, they were going home, but we were not sure about the quality of the healthcare. And now because of these injuries which have been recognized or which have been identified, it is seen that there is a need for or there are the patient safety is questioned. So despite of all the known power of the modern medicine to cure and ameliorate illness, hospitals were not safe places for healing. Instead, they were the places fraught with risk of patient harm. Therefore, the important response to this realization has resulted in the growth of the interest in the patient safety. So many of the organizations, they have realized that the patient safety, which is putting a burden over the patient as well as the healthcare system. So patient safety is now recognized in many of the countries with a global awareness fostered by the WHO. Hence, patient safety has become a discipline complete with an integrated body of knowledge and expertise. What is when we talk about patient safety, it is always interrelated with the patient and the harm. So what harm the patients are getting? The patient and the harm are defined based on the cultural constraints in the different region and epochs. So in different organization, how vigilant they are while providing the patient care, whether there is any system existing there to check for the patient safety. So that also matters along with the organization culture. Early medical and surgical treatment are considered harmful based on the current standards. So, what do we mean by harm? Harm in the healthcare is defined as adverse outcomes such as death, injury, and infection. So, when the patient safety question arises, it is always related with the harm. And harm, it is defined as there is some outcome from the healthcare or the treatment which the patient is receiving. Maybe the improper treatment or maybe the outcome of that treatment, it may result, which is resulting into death, injury, and infection. So there are few terms which describes the harm to the patient. We must have come across with the term adverse event. What do you mean by adverse event? Adverse event means any event or any incident which is resulting out from the treatment. It is harmful to the patient. So it is resulting into the harm or a harm to the patient. Second is near miss. Now, when we say near miss, it is about to happen, but it has not harmed the patient. It was realized and it was corrected in time. And the third one is sentinel event. Means any of the incident which is resulting due to the treatment or due to the patient's stay in the hospital or healthcare setting, and it is resulting into the harm or maybe going to result into the harm, it is called as sentinel event. So I can give you the example of adverse event. Now, for example, a patient who is impaired visually and patient is going to the washroom and patient is not able to walk or is not able to see, nobody is there to accompany the patient and patient had a fall. Patient had a fall, but patient does not have any injury, maybe a slight fall. So that is an adverse event. Near miss is like any medication in an emergency her nurse is trying to give, but she realizes that that is not the right medication and she does not inject or administer that medication to the patient, rather than she realizes before administering the patient. So it is prevented, that harm is prevented by in time or before resulting it into any major complication. Sentinel event is any harm which is resulting from the treatment. Like for example, patient had a fall and patient had broken his bone, or maybe there is a fracture resulting out of fall. And after resulting of fracture, that is a sentinel event. But on top of that, if a patient dies, then it is really a sentinel event where the patient had come for a treatment of some other condition. Patient had a fall, patient had a fracture, and in that fracture, by treating the fracture, again patient has lost his life. So that is a sentinel event. Now let us see regarding the definition of patient safety. When we say about the definition of patient safety in a term, the safety is a discipline in the healthcare sector that applies the safety science methods towards the goal of achieving a trustworthy system of the healthcare delivery. Now, patient care safety, it is in a simple word, it is an attribute of a healthcare system which it helps in minimizing the incidence and impact of and minimizes the recovery from the adverse event. In a simple term, which we say that it is to avoid or prevent the unnecessary harm resulting out of the treatment whenever the patient is coming for the treatment. The patient safety is often assessed based on the five outcome. These are error, adverse event, infection, injuries, and mortality. Now, when we talk about components of patient safety, how these components are being developed. These components are developed based on the outcome and causes leads to the development. Now, these are the state policy, diagnosis, medication, surgical procedures, and infection. So let us see in detail about this different components of patient safety. Each one has its importance as well as injury. So when it is been placed or it is been described in the form of hierarchy of the patient safety. Now, these patient safety components, in this, we can say that the patient safety components is placed in the hierarchical fashion and which is based on their visibility. Now, what do we see first? We see first injury. So, injury and mortality is seen very evidently, which may be the result of unsafe stay of the patient in the hospital or maybe a healthcare. So, injuries affecting the patient safety are more visible when you compare that with the first component, that is a state policy. Now, what is state policy and how do it plays an important role in the patient safety? All the states have to have some policy for providing healthcare facilities for the people, those who are residing in that state. Of course, it is a responsibility of a country, but even at the state level, there are various policies which is meant for the people's welfare as well as the healthcare issues. So healthcare policies are there, which we see in the form of medical insurance, which can be like the state can help by permitting the medical colleges for the medical education, especially the residency training. So all healthcare professional or professional training has to be, there should be a provision and a policy for training certain number of candidates or the professionals, those who undergo the medical education, so that they can provide a safe healthcare or safe services to the people. Now, healthcare policy. I can give you one example of Maharashtra state. Maharashtra state has a healthcare policy for the people, those who are very poor. So this is also state policy also associated with the poverty, poor housing and the racism. Here in India, there is no racism as such difference, but cultural difference is there definitely. And the poverty, the poor people who cannot afford the healthcare facility, they need to be given due to the financial problem or maybe the funds which are required for the treatment. So it is difficult and they get deprived. They don't approach the hospital because they cannot afford. So for that, the state has made a provision or has to make a provision that these people should not be deprived and they should be provided some sort of help. So Maharashtra government under the scheme of Mahatma Jyotiba Jan Arogya Yojana has given a facility or has made a provision for the poor people who can approach for their care, so that the because of financial burden they should not step backward, but they can go ahead and get treated for their problems. Similarly, Pradhan Mantri Jan Arogya Yojana is also it is also existing for the people who cannot afford. So for them, at least they can, under this scheme, these patients can be covered and they can be treated, and their treatment is completely free. So this is at the state level policy which exists. Now, second component which we say about that is the diagnosis. How do the diagnosis play important role in patient safety? All of you know that if the patient's diagnosis is not made proper or it is not accurate, the treatment will not be proper. So the diagnosis, it requires a skill and the knowledge to diagnose the disease. So whenever a patient is approaching to the hospital, the diagnosis has to be made accurate. Inaccurate diagnosis may lead to some short-term and long-term harm to the patients. So short-term may be like patient may not be identified because the doctor is not able to diagnose the patient what exactly the patient is having, and maybe wrong treatment is given or there is a delay in the treatment. So that condition may get aggravated, and after that, once the diagnosis is there, so sometimes there is a harm because of this diagnosis, or it may be a wrong diagnosis. Another one incident I can just share with you. A patient going for MRI, this is not related to the diagnosis, but the environment over there is like patient going for MRI. One incident which has taken place in LTMG hospital in Mumbai. The oxygen cylinder was also carried along with the patient, and there was a blast of the oxygen cylinder which has harmed the patient. The patient has to lose its life. So maybe during the procedure, this can be there. or maybe the diagnostic procedures which is done for the patient. Even at that time, there is any injury, it may lead to harm to the patient, which may last for a short term, which may give a permanent damage. So therefore, there is a need of the excellent medical knowledge and the practices with most recent uh, information and with the scientific advancement in their medical knowledge. So when we say about this, the diagnosis is made, but it is not communicated. When the patient approaches the hospital or the healthcare facility, there should be a proper communication between the doctor and the patient. It is a you have to involve the patient in his own treatment. The patient has to be explained completely what is going to happen, what procedure is required, what is going to be the outcome, what cooperation is required from the patient and the patient's family during the treatment, after the treatment, before the treatment. So all this, and it should be in time information should be given to the patient from the healthcare. So communication plays a very important role. Other than that, I would like to say that communication here, when they are giving a handover, so the accurate information, even the patient should not hide any information from the doctor, so that the treatment should not be given as wrong treatment. So for here, I would like to give you one example that if a patient has consumed some tablets and patient is approaching a hospital saying that the patient is having giddiness or something, and the patient is not giving any history that he has consumed some medications, large amount of medication, and then the diagnosis, the time is wasted in the diagnosis and confirming what really has happened to the patient, and it delays the conclusion for diagnosing the patient. By the time the drug or whatever the consumption the patient had, it will affect, and it may affect patient permanently, or it may have the patient have to lose a life. So communication is also important. We all know that medication plays a very important role, and there are this is a plays important role in the patient safety. Majority of these errors or medication errors which have occurred has resulted into some harm to the patients. Like when we say about this medication as a component, or we consider medication as a component of the patient safety, the failure in prescription, transcription, dispensing, and administration, as well as documentation, has put patient at risk. So we all know that if the doctor has prescribed the medication, wrongly prescribed a medication for a patient, maybe the dose, maybe the time, maybe the type of the drug, what it is being prescribed. If it is being transcribed from the ward to the pharmacy and is not in a proper way, maybe there is where there is a requirement of a lower dose and the higher dose is being issued or dispensed by the pharmacist, and unknowingly, if whatever the nurse, whatever the doctor has prescribed, the nurse administers this wrong medicine to the patient is at risk of being harmed by that medication. Therefore, the information or the knowledge on LASA medications, the high risk medications, the narcotic medications, etc., all this has to be very, very in depth, and one should try to avoid the errors which result from the medication. So, it is already known all over worldwide that medication error is a leading cause of injury next to the medical treatment. This demands, when we say that medication is one of the components of the patient's safety, so what does it say is that it demands the expertise of the pharmacist, the physicians, and the other healthcare professionals. Though there may be a mistake at the prescription level, transcription level, and dispensing level, but the nurse, who is a key person here, plays an important role by identifying the proper medication. The doctor who has prescribed the wrong medication, she can at least stop the further damage or further harm to the patient by identifying. So, nurse plays an important role in provision of the care in the patient safety related to the medication. She herself should be knowledgeable while administering, before administration, and after administration. she has to check and see to it that the right medicine, she has to follow the rights of the medication administration so as to prevent the harm to the patient. Secondly, the storage of the medications. We all know that the medication has to be stored properly, labeled properly. It has to be the expiry date of the medication has to be checked. The patient history has to be checked. The patient's assessment has to be done in a proper way. So all these things have to be done so as to prevent the harm resulting from the medication administration. Now, there is another component which we say that the surgical procedures, the harm resulting from the surgical procedures. So, all of us know that if the patient has to undergo surgery, the surgery has to be safe. So, safer surgery can be defined as a reduction in the unavoidable harm to a surgical patients. We have seen that worldwide there are 234 million surgical procedures which takes place. It is almost equal to that of maybe more than that of the childbirth. But 7 million complications it arises from the surgical procedure, whereas 1 million deaths worldwide occur each year due to unsafe surgery. It is a huge number. How many people are affected or how many people has to face this harm or tolerate this harm? The rate of the harm in the surgical patients is unknown, but probably occur in about 10% of the surgical patients. This is what we have seen, but we don't know what are the given figures. Though much of this harm may be minor. So surgical harm result from either wrong side surgery or wrong patient surgery, or there can be a retained instrument and swabs. We may come to know. That is why the nurse here also plays a very important role. So therefore, to prevent the harm resulting out of the surgical procedure, there should be a surgical safety checklist which can prevent a patient. But simultaneously, it is a responsibility of all the individual in the team, surgical team, for the surgical safety of the patient. According to the guidelines of the quality department, it is better to, like when we say that the harm resulting out of the surgical procedure, most of this error it occurs at before the surgery starts. Maybe there is a wrong patient on the wrong side, it is marked, and then the patient is sent for the surgery. Intra-op and post-op very few, but post-op if the patients are not monitored properly, then there may be harm or deterioration or maybe permanent or temporary harm to the patient. Next component is infection. Now here in the healthcare setting, we can say that the healthcare associated infections are very common, and healthcare infection associated infection, it is been found worldwide like 100 millions of the patients are affected by the healthcare associated infection, and it is leading to the significant mortality and financial burden on the healthcare system for the patient. We have seen very commonly occurring infections. These can be the infection due to any invasive procedure which is being carried out for the patient in the hospital during its stay. Now, WHO data shows that 5 to 15% of the hospitalized patients acquire healthcare associated infection. Now, this is the data what is being reported. The unreported things are still hidden. About 40% of ICU patients, out of this 5 to 15%, those who are hospitalized, they acquire, but about 40% of ICU patients, among them 12 to 80%, they result into death due to this infection. So it is a huge number. There can be infections which is device associated infections, as we know that one is clepsy. What do you mean by clepsy? It is a central line associated bloodstream infection. Another one is potting. It is catheter associated urinary tract infection. And the third one is VAP, that is ventilator associated pneumonia. These are the three major things which are device associated infection. But apart from that, we can also say that central line insertion practices. Now, central line insertion practices are also associated or may also result into the infection for the patient. And the another one is dialysis event. Let us see each one of them. CLEPSI, when we say CLEPSI, in short, we all use this term, that is central line associated bloodstream investigation. It occurs when the bacteria or any or other germs enter the patient's central line and then enter into the bloodstream. That is quite new. But how do we diagnose the central line associated bloodstream investigation? It is confirmed only from the laboratory. So there is a confirmation of the bloodstream investigation in a patient who had a central line within 48 hours period before the development of bloodstream investigation, and that is not related to an infection at another site. So patient is not having that infection at the other site, but when you detect, it will be detected from the catheter while insertion of the catheter, or maybe the unsafe or aseptic septic technique. We cannot say that aseptic. Aseptic technique is not used. CLEPSI rate in intensive care is very high because majority of the patient require central line, and it is estimated to be 0.8 per thousand central lines per day. It can be diagnosed when the culture result identify the same organism at least the culture obtained at the peripheral stick from a culture of the catheter tip. So the catheter tip is sent to the laboratory and then the culture is drawn out of it, and whatever the organisms have been found, it is that same infection which the patient is present. Next one is COTI, that is the catheter associated urinary tract infection. Now this is the most common infection as a person can contract in the hospital. According to the American Association of the Critical Care Nurses, indwelling catheters are the cause of this infection. An indwelling catheter is a tube inserted into the urethra. All of you know that this is a procedure which usually the nurses do, but maybe in some of the hospitals there is a practice that the medical doctors they do, or the residents they do. But the thing is that further care. Now, while insertion of this catheter, again, you have to be following the aseptic technique, the sterile technique, so that the infection does not get introduced into the patient's body. So, COTI occurs when the germ enter and infect the urinary tract through the urinary catheter. It may happen. It is not necessary that at the time of procedure only the patient can have this COTI infection. Later on also, if the drainage bag is not emptied enough, or the bag is not changed in time, the contamination of the bacteria, sometimes the bag is kept open, sometimes the catheter get disconnected, the tubing of that bag, urinary bag get disconnected from the catheter, and again the same is being inserted immediately or maybe after some times, then also there are chances of infection which the patient can get. Another cause is that maybe some of the bacteria from bowel movement get contaminated, or there is a contamination of the stool. No proper care, or there is no catheter care provided to the patient till the patient is presenting the symptoms. Irregular cleaning of the catheter, or inappropriate technique used while cleaning of the catheter. And even if the urine from the catheter bag flows backward into the bladder, that this can also cause the urinary tract infection. So there are various reasons apart from the procedure. So there is a guideline given by the National Health Safety Network by CDC how these COTI can be prevented. Another one is dialysis events. Now, as dialysis events, it is not been traced or it is not been tracked by many of the hospitals. Maybe there may not be this particular facility present in the healthcare, but wherever there is a dialysis facility, they do track this dialysis events for the infection rate during the procedure of the dialysis, because many of the patients, they have to undergo or they have to have a fistula formation for the dialysis procedure. So during the fistula formation or the procedure of that fistula, even that time also the infection can occur, or maybe that at the time of dialysis the infection can occur. So IV antimicrobial start is very important. If the patient shows a positive blood culture, if there is a pus or redness or increased swelling at the vascular site, this can tell us that there is a infection at the dialysis procedure. Now, next one, what we say is VAP, that this is ventilator associated pneumonia. All of us are aware about this ventilator associated pneumonia. Initially, also it was there, but it was diagnosed as ventilator associated pneumonia, which develops. Now, when we say that ventilator associated pneumonia, it develops 48 hours or longer after the mechanical ventilator, and is given by means of an endotracheal tube or tracheostomy. We cannot say that within 24 hours the patient is having a pneumonia, that means that is related to the VAP. But after 48 hours of intubation, if the patient develops pneumonia, then it can be said that it may be associated with the VAP. And it is by means of an endotracheal tube or tracheostomy. Ventilator associated pneumonia, it results from the invasion of the lower respiratory tract and the lung parenchyma by microorganisms. The common positive organism of VAP includes gram-negative, but even gram-positive bacteria such as Staphylococcus aureus can also get introduced. The patients with chronic obstructive pulmonary disease showed 2.35 times more likely or more vulnerable to develop a VAP infection as compared to that of the patient those who are not having any lung issues. Now, how to prevent this? The prevention is like, if the patients, instead of invasive mechanical ventilation, if there is a non-invasive mechanical ventilation provided, if the sedation holidays are in practice, if weaning trials are done, sometimes avoiding the re-intubation. Many times the patients are intubated and due to some reason, some of the other reason, patient is re-intubated. So there are high chances of patients developing VAP. And the early tracheostomy may have shown a good amount to decrease the VAP. Now, injury. The patient's safety is really questionable, because if a patient is admitted in the hospital and for some treatment, and patient is going or patient is developing some injury or harm, maybe due to fall. There are various reasons, like the injury may occur either with the device, like for example, if the patient is taken for surgery and the artery pad is not properly earthed, then there is no proper earthing for that. The patient may get burned in the OT. That is also a harm for the patient. It also results as an adverse event. Now, some other injuries which commonly occurs, that is fall in the hospital, like especially the vulnerable group, children, elderlies, especially over the age of 65, they are more prone to have a fall, because either there may be some physiological or maybe some environmental reason to have a fall. Among these, we have seen that females are at higher risk than the males to have a fall or injury, maybe because of their osteoporosis or postmenopausal osteoporosis, which may result into a fracture injury. All types of these falls, which includes these, are always related with the physiological or the environmental. Now, when we say the physiological, I would like to give you an example. A patient who is after recovery from this illness, he is doing a physiotherapy, but like when we ambulate the patient out of bed, immediately ambulation, we are gradually ambulating, but still sometimes the patient's BP drops. The patient gets fainting attack and patient falls down. That is also one of the reasons where the physiological reason is there. There is no environmental reason for that. But sometimes the patient is walking around and patient slips down on a floor. There may be either because of the wetness of the floor, or maybe a fluid or water may be there, or maybe a floor may be slippery, or these are the glossy times where the patient has slipped down the floor. So this can be an environment. Another example I would like to give you here is like during the procedure of electroconvulsive therapy, ECT, the patient during the ECT, the patient convulses and develops a tongue bite. There is an injury, there is a huge bleed. So even if the care is not taken, the patient can result into the injury maybe during the procedure. Sometimes the unconscious patients, if you don't provide a side rating, these unconscious patients there are chances of fall. Second thing is that the patient, those who are having an impairment in their the cognitive impairment, like the patient is very agitated, patient is in a delirium state, patient may fall from the bed, or there may be aggressiveness in the patient, especially the patient those who are obesity, those who have come with the OPC poisoning, they are very aggressive and agitating. They just break the restraints and they harm themselves. Therefore, fall risk assessment is also very, very important to prevent such harm, and you have to identify which particular patient is at risk of developing injury. So, fall risk assessment is one of the part by which we can help or identify the cause and can use or can implement the necessary things to prevent this. Like for example, necessary devices can be used to prevent the fall or injury. Another important thing is that unsafe devices, any monitor or any electrical devices which are used for the patient. One example I have given is like cautery during the surgical procedure. Another one is like maybe a nebulizer, simple nebulizer, but the electric socket is not safe and there is a blast. It can also cause harm or injury to the patient. Another example I would like to give you, the patient who is just walking around and the tile which is not properly fixed, it has fallen on the patient's leg. It may cause injury to the patient. So any n number of, or maybe there is a fire in the hospital. Patients are not safe. If the patient has to suffer with the injury. So there are many reasons why there is injury, and ultimately because of this injury, there may be a death. It may give rise to increased death also. Especially now, the most commonly thing which is happening is the transportation of the patient from casualty to the ICU or casualty to the ward to ICU or ward to casualty. During the transportation, if you don't use the safety belts for the stretcher trolley or the wheelchairs, there are chances that the patient may fall from this trolley and wheelchair and may cause injury. So these can be preventable. So as today we have seen that every year we see that millions of the patients suffer injuries or die because of unsafe and poor quality of health. Now, why it is happening? Because of unsafe. When we say that unsafe and poor quality of healthcare, this is likely to happen. But we can prevent this. The unsafe has to turn into the safe, and the poor quality, if we go for the quality healthcare, definitely the patient safety can be kept intact. But many of the medical practices and the risk associated with the healthcare are emerging, and these are the major challenges for the patient safety. Training of the people, practices of the medical practitioners and the healthcare workers. This is also we have to ensure for their competencies, whether they are really competent enough to provide the safe health care to the patient, those who are arriving in the healthcare center. And definitely, of course, these medical practices are at risk of putting a burden of harm on the patient as well as healthcare system. So, out of these five components, what we have seen, five components of the patient safety, injury and mortality is very highly visible as compared to that of the other components. And this is the outcome which we say that, see, either the patient is injured or the patient is dying, or there is a death arising from the unsafe treatment or unsafe care, what we say. Now, coming to a conclusion, I would like to say that the safety of the patient during the provision of the health care that are safe and of high quality and is a prerequisite for strengthening the healthcare system and making progress towards the effective universal health coverage under the sustainable development 3. So, it is also important to recognize the impact of the patient safety in reducing the cost related to the patient harm and improving the efficiency in healthcare system. So the provision of the same services will also help to ensure or reassure and restore the community's trust in their healthcare system. Now, if, for example, any of the hospital, if a patient has developed some undue or has some undue incidents like injury or as related, from word of mouth, it will be, the trust will be lost from the people. That this particular hospital, वहाँ पे care नहीं मिलता है, the patients are not properly cared. My patient has developed this or that particular harm. So, with the word of mouth, it has been spread, and the trust among the healthcare system or the trust over the healthcare system is lost. So, to regain or to reassure them, one has to take a step to know that the patient safety is at priority, it has to be taken as at the priority level. The people, those who are involved in patient care, has to be knowledgeable as well as competent and skillful for providing the healthcare services, so as to reduce the patient harm. Secondly, how to collect or how to ensure there are certain formats or the tools which are available to collect the data related to that, what quality of care we are providing to the patient. So these are various methods how we can ensure that the patient safety can be ensured, that the patient is provided with the safe care. So therefore, looking at these components, one has to see that each and everything, there are many, it is a very vast topic we go on discussing. It can be where it has occurred, how it has occurred, how we can confirm it. It is very vast. So at the most, I would just like to conclude that these are the five components of patient safety. One has to take it in mind and has to see very vigilantly that the patients are safe during their stay in the hospital. And they can take care. All these things are in our hand, healthcare professionals, that how to provide care in the same manner so as to prevent injuries or harm to the patient, reassuring or restoring the trust in the healthcare system. Thank you so much. With this, I end my session. I hope all of you must have got some information regarding the patient safety. If there is any questions, I would like to take it and I can answer for that. Thank you so much.
Many thanks to Dr. Padmaja Pramod Dhagle ma'am. It was very kind of you for taking out some time and giving some useful information that you have shared with us. That is the different patient safety and components of patient safety. That is different policies, diagnosis, and different medications such as LASA drugs and surgical procedures, and the e-dialysis events. That was really helpful in understanding the different components of the patient safety. Thank you, ma'am. Now, I would like to welcome so the next speaker of our webinar is Mrs. Sarika Sukesh Nayan ma'am. She is a tutor cum clinical instructor. The professional qualifications are she has done her BSc Nursing from Vivekanand College of Nursing, Chitradurga, Karnataka in the year of 2008. And she has also done her MSc Nursing in Medical Surgical Nursing, and the year of passing is 2018. I would like to welcome Mrs. Sarika Sukesh Nair ma'am, who is going to deal with the session 2, that is types of errors in the healthcare system. So ma'am, you can.
Thank you, Zaida. Good afternoon to one and all the participants attending this webinar on patient safety. In the last session, Dr. Padmaja ma'am had given you a brief introduction about what is patient safety, the fundamental aspects of patient safety and its importance. So I hope like everybody had got an idea about basically what is patient safety and what is its importance. So my role here for today's webinar is just introducing you about various types of errors in healthcare safety. So basically, we are supposed to know what are the various errors that we may come across whenever we are working in any kind of healthcare setting. It may happen sometimes we may commit some error, but we were really not aware that it is an error that may happen, or it is an error that had happened from my side. So we need to be knowing about various types of errors that we may commit from our end, maybe intentionally or else unintentionally, whatever it is. So going to my topic. Introduction, I would like to say that healthcare system errors and patient safety always may go hand in hand, because why I would like to say it is because unless and until we control the chances of making errors in any kind of healthcare system, the chances of making the patient safe is less. So it means if you want the patient to be safe in a healthcare system, the chances of making errors should be less. Then automatically we will focus on patient safety. I have certain supporting evidences also for it. In a fact sheet details of World Health Organization published in the year September 2019, it was seen that the chances of adverse events that usually happens due to any kind of unsafe care was one of the 10th leading cause of death and disability in the world. At the same time, it was seen like every year, 134 million adverse events usually occur due to unsafe care, especially in hospitals of low and middle income countries. So we usually come under this criteria. So we need to focus on that point of 134 million adverse events basically happens every year. And even it was seen in a Harvard study that 5.2 million medical errors are usually reported from India annually. We will be seeing certain terminologies that you have seen in the introduction right now. And also in one of a study being conducted by Mr. S. Karande in the year 2021, they have reported that medical errors as one of the highest priority, most public health global problem, which usually is a threat to patient safety and quality care. So errors you can see in almost all of the slides which we have to focus more upon. That is, our introduction slide speaks about chances of making errors are less, automatically patient safety is good. So now we'll see the definition of error. So what is error? Error is the failure of a planned action to be completed as intended. That is, you're planning something to do, but you do not do it properly. You fail to do it. Or else you do something, you want to achieve that aim, but you find a wrong plan. The plan was wrong, or else you fail to do a plan. Both are known as error. So here I'll be dealing with the types of healthcare system error. I would say it is kind of revision that we can do. Basically, in the last session, madam had dealt various points, so just we'll revise it a little bit. So we'll just brush out each and every point. So the various types of errors here we'll be discussing is medication events, healthcare associated infections, surgical errors, laboratory errors, patient falls, pressure source, and documentation error. These are the major area which I'll be focusing, and we'll just see one by one in brief. So what are basically these medication events? So in this, I would like to focus on the point called as medication error. It is, you want to, it is like any kind of event that usually happens, especially in terms of providing a medication or so and so. I'll be dealing it in the next slide. So any kind of event that basically harms the patient, especially in relation to medication, but that event was preventable. You would have prevented it, but you did not do it, and it leads to harm. The patient gets harmed because of inappropriate medication, and such errors are known as medication error. So the commonly causing medication errors are especially when you prescribe a drug, you either does not look on to the doctors doesn't write on properly, they does not prescribe it properly, the dosage error, the handwriting that had made you a confusion. That is a prescribing a drug, or else when computers make an error, instead of writing 20, you write 2. So again, the dosage gets changed and you try to, it basically may lead to an error. Or else when the drug is being prepared or dispensed, that is why loading, instead of diluting 10 ml, you dilute only 5 ml, and it may cause a harm to the patient. Or else when the drug is being given, either you misplaced, instead of giving IM, you gave IV, anything can happen. So when the drug is being given or taken by a patient. So initially, from the moment you start prescribing a drug, and it ends till the time when you take the drug. So any kind of errors can happen at any point. That is basically the common medication errors. What could be the causes of these errors? We'll just see one by one. One is a distraction. Now, a nurse who is prescribing a drug, she was distracted. Maybe she is overloaded, or she had done a double duty, whatever it is. Doctor had advised her diazepam. I hope you know diazepam is a sedative. Instead of reading diazepam, she reads it as diltiazem. It is an antihypertensive drug. So I don't think that I need to explain you this. One is a sedative, another one is an antihypertensive, and you misplace it and you give it wrong. So that could be a cause of medication error. Second is environmental factor. Environmental factor means a nurse who is chronically overloaded with some kind of works may make error because she is very tired, or else because of lighting issues or any kind of environmental factors that interferes and cause a medication error. Or else third is lack of knowledge for nurses. When you don't have a knowledge about the action of a drug, the side effects of a drug, and you does not understand that before giving so and so drug, I'm supposed to check the vital signs of the patient. If the patient's blood pressure is normal, I'm supposed to take a consent of the physician who had prescribed this drug. We need to ask them. If you don't have any knowledge about the drug, it's very difficult to understand it, and the chances of making errors are more. That is why it is even included in the curriculum, especially in your second year, you start learning pharmacology in depth so that the knowledge level increases. The next causes of making medication error are incomplete patient information. In case if you have not collected adequate information from the patient, like whether the patient is allergic to any medication, or else whether the patient had any previous diagnosis, or if the patient is taking any kind of medication, you did not collect adequate information and you prescribe a new medication to a patient, so it may lead to an error. Then any kind of systemic problems like labeling is not done, two medications are kept together, both look similar, or else the names are somewhat similar. Just now I said diazepam, diltiazem. So these are the systemic problems that may lead to medical errors. The next medication event is adverse drug events. Adverse drug events means when you give any kind of medical intervention to a patient, because of that medical intervention, if any injury happens, That is what is called as adverse drug events. Even your medication error itself is an adverse drug event. Any kind of side effects that happens in a patient, like any side effect related to injection penicillin, you have not done a test, you have not given a test dose to a patient and you have administered it any kind of higher antibiotics. So any kind of injury that results from the medical intervention related to a drug is what is called as adverse drug events. Even your overdoses are also may also lead to adverse drug events. Then high alert medications. Basically, any kind of drugs, if you do not give it properly, or else any kind of mistakes that happens, it is an error. It may harm the patient, but the chances of making error, if the errors are made in relation to high alert medication, the severity is very, very more in the patients. That is why the medication itself come under the category of high alert medication. I have listed down certain examples of anticoagulants, narcotics, insulin, sedatives. They all come under that category because you need to be very alert when you give this medication, because any kind of mistakes may lead to a higher damage, a higher harm to your patient. That is why here in a high alert medications, the strongest labeling is very important. What is about it? I think you will be dealing with that in the next session, so I'm not going into it much detail. Next kind of errors are healthcare associated infection. So there are various infections that a patient may come across when they get admitted to a hospital. So according to CDC, they have prioritized it under catheter associated, Clostridium difficile infection, central line associated, MRSA, surgical site infection, ventilator associated pneumonia. There are 6 criteria. So we'll see. First one is surgical site infection. The name itself speaks, surgical site infection. So the infection which is usually found after surgery, where at the surgical site. So basically, more commonly it is found superficially over the skin. And rarely it happens that it goes deeper inside, like it affects your tissues or organs or implanted materials. But mostly it is seen over the skin. And when I have written in the board letters that it is one of the largest type of healthcare associated infection, because basically when you get a patient with any kind of in a post-operative state, we usually do dressings and we try to keep the wound clean. Any kind of a mistake that happens, error that happens during wound cleaning, during dressing, so this may lead to a infection which may progress very badly. When it may enter inside the skin, it may go deeper into the skin and may land up in much more issues in the patients. So surgical site infection is also a kind of error that we may usually make, which may affect the patient's life. Next is central line associated bloodstream infection. So central line, I hope everyone knows, central lines are basically put over the largest vein of your neck or femoral, through which you basically give medications. But there are chances that even that line may lead to a causative factor for any kind of infections. I would say with the help right this image, you can see here once it is written number 1, it is written as extraluminal, and second it is written as intraluminal. Extraluminal means outside. When does that the chances of getting infection is more, especially during insertion of catheter. When a physician or a healthcare person and they does not follow a proper insertion technique, then the chances of the organisms to enter inside is more. So that is why the catheter tract contamination may happen and it may lead to infection. So what happened? The bacteria will migrate through that tract and it goes inside the blood. So that is what is called as catheter related bloodstream infection. Whereas intraluminal is inside, because you are trying to give medication to this, you try to give any other fluids through the hub. That is hub contamination happens. like you does not do it properly, you does not flush it properly, you does not close it properly, you does not clean it properly. So due to any kind of reason, if the IV port gets contaminated, the chances of bacteria entering inside the lumen and moving into the bloodstream is more, and it may lead to infection. This is ventilator associated pneumonia. Ventilator associated pneumonia. So it speaks, it is also a healthcare associated infection. Usually it is found in patients who is on ventilator. What is a ventilator? It is an artificial respiratory support that we give to patients who cannot breathe by themselves. So this ventilator associated pneumonia or else sepsis or acute respiratory distress syndrome, pulmonary edema, these all are complications being basically seen in patients receiving ventilation. And if a patient gets this infection, ventilator associated pneumonia, what it will lead to? The patient's stay in hospital will be long. It will result in longer duration of hospitals, ICU stay. At the same time, it will lead to longer duration of mechanical ventilation. So the chances of patient remaining in the hospital and the chances of the infection to progress is also more. So when you look into the image, I can tell you which are the various areas where we could see the chances of getting infections are more, and there are colonies of infection that has been found in case of ventilator associated pneumonia, especially healthcare providers' hands. When we do any kind of procedures, when you endotracheal tube and you do any kind of suctioning and all. So this is one area. Second is the tubing itself. The tubing itself, that is outside as well as inside. Next is in the pharynx, oropharyngeal area. The secretions or the colonies are found more in the tracheal area. So why? When you find these colonies are present throughout this area, the need for suctioning is also more, because you should not allow a colony to remain there. You are supposed to take the colony. If you try to take colonies out, the chances of the disease to progress is also less. So hand washing, it will start from hand washing and the various strategies to remove these colonies out, and the strategies will be dealt in the next. So this is what happens in relation to ventilator associated pneumonia. Next is catheter associated urinary tract infections. Now we have seen one was endotracheal tube, and this is a urinary catheter. It is related to a catheter associated urinary tract infection. So this is usually found in patients who are with urinary catheters. So in the hospitals, post-operative or as any kind of issue, you can see majority of the patients might be with Follis catheter or silicone catheter, anything. So again, that is also a site wherein which gives a very crucial entry for a microorganism to enter inside the body. So the patients who usually get this urinary tract infection, they come out with a symptom of burning pain in lower abdomen, burning micturition, increased frequency. These are the general symptoms, what I could say. But in catheter associated infections, what you can find is the patient's blood vessels changed. That could be a point where you can assess. At the same time, if you do a urine specimen culture, again you find out what is the organism that has been found in the catheter tip or else in the urine. So the preventive strategy usually focuses on looking into that site so that the organism does not enter inside the stream. Does not enter inside the body. So the prevention should be focused on that. So that is what is called as catheter associated urinary tract infection. Errors that happens especially during surgery. Either the errors can be like, I have noted down 3 areas. It could be a wrong site surgery, wrong procedure surgery, or else wrong patient surgery. A site was wrong, or else the procedure itself was wrong, what you did, or the patient was wrong. So all these errors these all are considered as never events. Never events means the errors that should never have occurred. Essential events. Essential event means the events that may result in death, or else permanent harm, or else temporary harm, or else it may result in certain intervention to be done on the patient to sustain life. For example, A patient went for a radiological investigation and it had been found that there was some kind of issues in his right kidney, and following many aspects, finally the surgical management been decided was to remove a right kidney. But due to some kind of any error at some department, the surgeon removed the another one. So now what had happened? A good one is out and the bad one is there. So now it is a sentinel event. Why? Because it requires an intervention now. What is the intervention? The patient needs a dialysis support now to sustain his life. That is what is called as a sentinel event. So it can be a never event or a sentinel event. Then there are errors such as laboratory error. Laboratory error basically happening in the laboratory. Either a wrong specimen is being collected, or a specimen is labeled wrong, or else the report itself is being analyzed wrong. So why it may usually happen is some kind of communication errors between the laboratory person as well as the healthcare professionals, or else the specimen that they had collected, they have labeled it wrong, or else they have collected the specimen from the wrong site, which was not needed. And then finally, the report was also made wrong. So these are the errors that may happen. Patient falls, as madam had said, that patient fall is according to Agency of Health Research and Quality. Patient fall is any unplanned descent to the floor. Like a patient may slip or fall, either the patient get injured or else may not get injured. Sometimes the patient may get fracture, lacerations, or bleeding, which may lead to a patient's longer stay in the hospital. So it is again affecting the patient's safety also, very important. So patient falls may usually happen in case if the patient is weak or tired or ill, or patient is not physically fit for it, or it's because of medication. He had a sedative just before it, you gave him some medications, or else any kind of side effects of any kind of other medications, or else in case the floor was slippery, the room was dark, which had led to the patient to fall. Then pressure ulcers or decubitus ulcers. I hope everybody knows it, pressure sore. So this is basically seen in patients who lie on bed for a longer period of time, such as paralyzed patients or post-operative patients or patients with fracture. And these are the commonly affected sites, that is ankles, elbows, heels, and hips. Next is documentation error, very important. You did many things, but the documentation was not correct. Or else in case if a physician wants to prescribe something, but the documentation style was not correct and someone interpreted it as wrong. So that may lead to a patient harm. That is, physician's handwriting was not good, charting error was done, or something had been omitted, you did not look into it properly. So these all are considered as a documentation error, which may lead to, which may harm, which may cause affect patient safety. So even nowadays, at many hospitals, we are maintaining electronic medical records. Even in that, the documentation errors happen. Why does it happen there? Because the chances of copy paste usually happens in any kind of electronic devices. So when you try to copy and paste, the chances of making errors are wrong. You copy something wrong and you paste it somewhere else, and it has been carried forward different various nurses. So the documentation errors even happens in electronic medical records. Those were the very important errors. I hope it was clear to you all. I have tried my level best to simplify it as much as possible. This is just a general other types of errors that we should be knowing apart from the different other types of errors. That is, one lateral failure, active failure, organization system failure, and technical failure. Latent failure is any kind of errors that happens in the organization or else in terms of software in the electronic medical record system, but they have not brought out two files to be like joining something. So what happens there? So what will happen? Whatever you document, it will be recorded wrong. Okay. So that is what is called as a latent failure, which may happen later. Right now, nothing will happen, but progressively, if the same system is being done again and again, it may lead to into an error. That is what is called as a latent failure. And active failure is right now any of errors that happen in relation to the patient. Like you are giving any kind of medication through infusion pump, and the infusion pump system was not correct, but you have added 10 ml, ml per hour, but system was not correct. Recognized it, identified it as 2 ml per hour, and the patient was not getting adequate medication. So here I would say that latent failure made it to fail. So latent failure, the distal was not correct, or else that system, there was some issues in the system. That was a latent failure. वो तभी नहीं हुआ. It may happen. So it led to an active failure, that is the patient received incorrect amount of medication. Then organizational system failure, it is any kind of indirect failure that happens in terms of any protocols that you make for the hospital or for the patient, any kind of transfer of knowledge or any extent, anything. It's somewhat like environmental factors. And finally, technical factors. Sorry, technical failures. It is just a minute. Technical failure, it is like any kind of failure of facilities or external resources, like and anything from the which is not in direct relation to the patient. It is again a kind of latent failure. So these are the other types of failure that we see. Basically, the most important is the initial 7 points that we have seen, and these 4 are the supporting ones. These are the references that I had went through. Thank you so much for giving me opportunity to speak on the different types of errors. I hope it was clear to you all, so that you identify the chances of making error and which are the errors that you may make, or else which you could prevent, so that the patients are safe in our hands. Thank you so much once again.
So thank you so much, Mrs. Harika Sukesh Nair, ma'am, for focusing on the topic of types of error and elaborating in the healthcare system. Thank you for that praiseworthy information that you have provided to all of us. Now, I would like to welcome the next speaker. The next speaker is Mrs. Suparna Patel, who is the principal of Human India Trust. Here, I consider, I'm so sorry. So, Mrs. Suparna Sunil Patel, who is the principal of Human India Trust, School of Nursing. The professional qualifications of ma'am are, she has done her GNM from the Bombay Hospital in 1989, and she has done her PBBSc nursing from IGNOU in 2001, and she has pursued her MSc in the field of community health nursing from LT College of Nursing, Human University Churchgate, and now she's pursuing her PhD from JJTU. Now, here I consider it a great honor to welcome Mrs. Suparna Sunil Patel, ma'am, to carry forward this session. Thank you.
Okay. Good afternoon, everyone, students and my colleagues. Yes, I'm really thankful for inviting me for this session. And I think both the speakers have made my session more simple and easy, because they have already covered the basic things for you. So I will start with my session. I will share my PPT. Should I? Can you see? Can you see my PPT? Hello? Hello?
Yes,
Am I
ma'am.
audible?
Yes, ma'am.
Yes.
Can
You
yes,
can
yes.
see my
We can see.
PPT.
Yes, yes.
Yes. Okay, okay, thank you. Okay, so I will start with my PPT with one quote. Basically, if you will see, you don't build a house without its foundation, and you don't build a hospital without its nurses. Same way, we cannot treat patient without thinking of their safety. So it is very important to think of safety. And my topic, as you know, emerging challenges and strategies to improve the patient safety. So basically, if you see previous lecture, which was on error, if we will reduce the error, if that is very easy for us to improve our patient safety. So this is one of the cause which leads to the improvement in the safety, patient safety. If you will see, every year nearly for 4 lakhs 44,000 people or individuals die due to the avoidable hospital errors. See, so if we try to reduce our errors, we will give more safety to the patient. Fortunately, the care providers, support staff, and the consumer can improve the patient safety outcome. So if we are reducing the errors, if we are thinking about the safety of the patients, we are really going to improve the outcome of the patient. Patient safety is fundamental to delivering quality essential health services. So when you are giving a safety to the patient, that patient is surely going to come to you, your institution, because they know that it is their first, we should know that it is the right of patient, as well as they know that if they are safe, they are in safe hands, they will always come to us. Indeed, there is a clear consensus that quality health services across the world would be effective, safe, and people-centered. Even same way, we have to think of the patient's safety each and every time. I think one second. I have to. One second. Okay. I think now this is full screen, right? Okay. So now if you know that 17 September is the World Patient Safety Day, and the purpose for celebrating this day is to promote the patient safety by increasing public awareness. You all must be knowing that we are taking care while providing the comprehensive care to the patient in the institution, hospitals, or maybe the grassroots level in the PHCs and everywhere. But you will find that there is need to make the people aware about their own safety. So the first purpose of this celebration of this day is increasing public awareness and engagement, enhancing global understanding, and working towards global solidarity and action. A continuous improvement based on the learning from errors remains an important cornerstone in patient safety. So it is very important that we have to learn from the errors. If you all know that there is a one rule in maths, it is said that you are allowed to make many mistakes. Okay, you are allowed to make many mistakes, but you are not supposed to repeat the same. So I will like to tell you that if any error you have made once, so that same error or mistake should not be done again. So that will give learning from that error has to be done in nursing, because we are dealing with the lives. To see the principles of patient safety, you can see that proper identification. Just now, this one, Nair has told us that there are mistakes in surgical interventions, that the organ, the site, the wrong patients, and so many things happen. So first and foremost, what principles you have to follow when you consider the safety of the patient is the identification of patient. And then you will think of prevention of operant handover. You know that when you are working in the clinicals, you have to give handover. And if there are errors in the handover, you can overdose or you can miss the doses of the patients while giving the treatment to the patient. Third principle is assessing the medical accuracy. Now, even Padmaja madam and Nair madam, both of them have told that how you can take care when you are giving medications. You know, FIFO, first come, first in, first out, and all regarding the medication. So accuracy has to be there. The dosage which you are giving, whether the calculation is done accurately or no. So that is very important. Next principle, if you will see, the performance of correct procedures. You have seen the procedures, you have seen the ventilator acquired pneumonia and all these nosocomial infections in previous slides and previous presentations. So you need to do the correct procedure at correct time and by avoiding the infections to the patients and taking the safety measures of the patient. Then last principle, if you will see, take appropriate precautionary measures. Yes, precautionary measures are very important. Again, the precautionary measures means what? You will again think of the patient's safety. So these are some principles related to the patient safety. If you will see, in 2015, the regional strategy for patient safety in WHO South East Asia region, that was for 2016 to 25, was endorsed during the 68th WHO Regional Committee for the Southeast Asia. All member states, that is also including India, had this strategy, and the aim of this patient safety strategy was to support the development of national quality of care and patient safety strategies, policies, and plans. If you will see, they have given strategic objective into this strategic plan, but you will also see that we can have this thing. The India also has worked on it. And what India has done, they have started with the regional strategy for the patient safety, and the Ministry of Health and Family Welfare of the Government of India constituted a multi-stakeholder patient safety expert group in August 2016. I appreciate for that because within a period of 1 year only, we have worked on it, and we have understood that how the patient safety is most important as your webinar's topic, that is a post priority. So India also has understood this priority, and they have formed this expert group. The aim of that is to develop the national patient safety implementation framework, and this framework is working in India and will be working for the benefits and patient safety. If you will see the 6 strategies or objectives one by one, the first aim is to improve the structural system to support quality and efficiency of healthcare and place patient safety at the core at national. We know the term core, that is the middle of the part. This is more important. We always use the core organs, the core temperature. So same way we are considering as a most priority as a patient safety. And then we are also thinking at not only the national level, subnational and healthcare facility levels also. Now we know the healthcare facility levels, 3 levels are there. In this, the institutionalized patient safety and strengthen the legislative and regulatory framework is there. Then strengthen the quality assurance mechanisms, including the accreditation systems. Now, you know, everywhere, wherever you go, NAC is there or NABH is there. Yes, that is very necessary to keep your standard updated. And when you tell that we are NAC accredited, your college or your hospital is NABH accredited, you feel proud about it. So that gives the our patients also a standard quality and the safety, establishing a culture of safety and improving communication. Then patients identification, handing over transfer protocols in healthcare facilities. So first, if you will see, the strategy what they have made, that the basic things they have discussed. Then establishing the patient-centered care and involving the patients as partner in their own care. So what we do, I remember when I was doing my nursing, we never used to allow the patient's relative to come inside the room, or we used to keep them out. And each and everything I remember, even the medication we used to give in the hand and give the water poured in the glass and give. But today, if we see that we are involving the patient as well as the caregivers to do any procedure or any part whenever they are admitted in the hospitals, we allow them to do it. And that is very nice change I can see in the patient safety also, because finally the patients from where he has come, from home. So the caregiver only will be taking care after they get discharged. So it is very important that the involvement of the patients and the caregiver should be taken care. If you see the second strategy, to assess the nature and scale of adverse events in the healthcare and establish a system of reporting and learning. Just now, Nair madam has also told, when she told about the medication, that sedatives and all other, means you have to be aware, you should be having the knowledge about the adverse effects of whatever you do. We in nursing, we say that whenever we are doing any procedure, we write the rationale. So you know what is the reason you are doing any steps for the patient. So that is very important here. So in this, we do generating the evidence for policy making. So we will be giving the feedback to the people that what are the adverse events takes place in the healthcare. And depending on that data, they will be changing the policies or making the different policies. Establishing robust surveillance system for monitoring patient safety. Actually, we should have a surveillance, means survey we should do that, where there are lacunae, where the patient can be given more attention and the patient safety should be considered. Like we know if the patient is unconscious, undergone any procedure, surgery and all, and the nurse or anybody who forgets to put the railings, the patient has the chances of falling. So there are different areas where we can do the survey and find out where the lacuna is there and how we can improve that. Next is the ensuring supportive legislative mechanism for effective functioning of patient safety surveillance system. So legislation also is very important when we are taking the thinking about the adverse events. Third strategic objective is to ensure a component and capable workforce that is aware and sensitive to patient safety. Very important. I will like to quote one sentence here, that patient safety is your safety or nurse's safety. Because if the patient is safe, you are safe, your designation is safe, your salary is safe, everything is safe, means your job is safe. But if there is problem in the patient safety, you are also not safe. Please remember that. Be sensitive about the patient safety. So in this, we will see 2 points, that is strengthening education, training and professional performance, inclusive of skills, competence and ethics of healthcare personnel. So the person has to be well qualified professionally. They should increase their knowledge. They should increase or be skillful, competence enough and accountable. Next is improving the understanding and application of patient safety and risk management in healthcare. So wherever you find there is need to improve and wherever there is a need of application for the patient safety, do that. Fourth strategic objective is to prevent and control healthcare associated infections. Now I will not go in depth because both of them have talked about the different types of infections. So nosocomial infection, we know that we should try to avoid wherever it is possible. Then the fifth strategy objectives to implement global patient safety campaigns and strengthening patient safety across all programs. So all the programs now, this all the points you will be knowing, that is safe surgical care, safe childbirth, safe injections, medication safety, blood safety, medical device safety, and safe organ, tissue and cell transplantation and donation. So these all safeties you have to take care at the global level. And the last strategic objective is to strengthen the capacity for and promote patient safety research. We always say that without research, nothing is there, because we are all now evidence-based practice nurses. So we need to do research in this area also. You have to encourage the nurses, even at the BSc level, and further also to do the researches in small areas. So this patient safety also you can do that. Coming to the National Joint Commission 2021 has given 7 patient safety goals. And if you will see these goals, you can see the accuracy. It is a repetition little bit. If you one pick only can tell you more details. That is P for the patient identification. Second is report and communications. Then administer the medicines cautiously. Infection prevention, then suicide risk detection, and eliminate the surgery errors. So these are some of the goals you have to follow when you are taking care or talking about the patient safety. Then coming to the main point which I need to discuss very elaboratively, that is major errors or challenges to the patient safety. So first, if you will see lack of proper mandates. This is because now we see that each and every one is trying to get NAC accredited, NABH accredited. So there are accreditation bureaus are there where you can get it accredited. But you have to see that whether it is doing it properly or they are not maintaining the standards. Now, when we go to the small nursing nursing homes also, you find that they are getting accredited. But when we are working on this accreditation in a NAC, or you must have worked for the NABH also, so many documentations, so many changes you have to make. Then I really wonder that how these people are getting accredited. Yes, so that you have to see. Okay, so you have to see that lack of proper mandates are available or no, whether they are maintaining the safety measures or no, standards or no. Then second challenge, if you see, healthcare delivery system. Yes, there is a fragmentation of the health system and the absence of the quality assurance system is there. Very like MGM, then you have this DY Patil, Bharti Vidyapit. These are the largest bedded hospitals, and all the hospitals in Mumbai, they all carry all these delivery systems, this thing, quality assurance systems they carry. But in other small hospitals, you will find that these all things are lacking, and that's why we have to take care that healthcare delivery system is properly maintained and quality assurance also is maintained. Third challenge is lack of leadership. Yes, many of the time you will find that there is a absence of leadership. The person itself may be very good, the person will be very much knowledgeable also, but that quality of leadership may be lacking in that professional. It was said before that the leaders are born, but I will say that leaders can be made. So everyone has that capability and initiatives and efforts. If they take, they can be a leader. So we have to see that that leadership qualities are developed when we are teaching also from the grassroots. When they are joining nursing profession, we should start developing those leader qualities in our professionals. So there appears to be limited sense of responsibility or urgency, because when their leadership qualities are not there, they may keep it pending. They will not understand the importance of the urgency or emergency. So that should not be there. It becomes a lacune or barrier. So we should, all of us should develop and make the good leaders in nursing profession. Fourth one is professional culture and lack of pressure. Professional culture is nothing but the adverse events and the rigid workplace hierarchy, the absence of pressure to change their organization or individuals. Everybody knows that nobody wants change. What is going on, let it go like that only. But today's in 21st century, it will not happen like that. If you want to survive in this profession, you need to change, and everyone knows that the change has to start from self. So everybody has to think of the changes what are necessary for the patient safety. Fifth point is issues of patient safety not emphasized in education. Yes, I want to say that if you will see syllabus, there is not a single one lecture or one topic where you are discussing everything. Of course, there are some few topics are there where you discuss, but as a main topic, patient safety, it is not in syllabus given, and that much importance is not given. So we need to emphasize on this topic in the education also. Sixth point is training of providers about patient safety. Yes, very important. Not only the nurses, but the people who are around the patients, the team members, then it can be a housekeeping people, the ward boys, whoever, liftman even. Everybody knows that in foreign countries and many of the hospitals, even this BLS and ALS training is given to the these liftmans as well as the other workers also. So we have to provide training to the people who are going to come in contact with the patient. So that is one challenge we have to accept and make the changes wherever it is and however it is needed. Seventh point is patient education. Yes, just now we had discussed in previous slides also that participation of patient is very, very important. Again, this care provider who are their relatives and all, you can communicate with them in proper way and educate them so that their behavior will change and the safety barriers will not be there and lead to the overuse of medicines. Like, you have to give education to patients in many sense, like taking medicines is not good. Too many medication without prescription taking medications is not good. So like that, many aspects will be there which you have to educate the patients for their own safety. I have one example, like my own relatives only, my daughter's relative, that she has lost her both the kidneys, means that both the kidneys are not functioning, and the reason was she had taken this medicines for becoming thin. She was very obese, and she had taken medicines, I don't know how long and all, but at present she is continuously on dialysis. Her both kidneys are damaged and she has to go for the transplant. So these are all things we have to explain them, educate them. Whenever you are coming in contact with the patient, try to give them the knowledge which will be in future it will be for their safety. Delivery of patient care. The way the care of patients is organized and delivered in India, very important. Delivery of the care is very, very important, whether it is in the hospital or in the community. You have to see that you follow the steps, you follow the rationale when you are providing the care. It is comprehensive and which is going to benefit to the patient. Problem next is problem in communication. Very, very important. I always tell that communication is very important aspect of the nursing, because you come in contact with thousands of people in a day, maybe. And if you have preoccupied mind and you have stress in your mind, you will not be able to communicate properly, you will not be able to listen properly. So problems in formal and informal communication can lead to the patient safety, because what you are telling the person may not understand. Now, I will not go in barriers of communication or all, because it is basic, you all must be aware about it. Due to the parentalistic system of healthcare, like we use so many medical terms when we are talking to the patient, but do you take a pause to at least see that that person is understanding what you are saying? What are big terminologies you are using? So it is very important to see that when you are communicating to the patient, when you are communicating to the relatives, your language should be simple and understood by them. This is very important. Patients and caregivers are not given the adequate information, or sometimes it is misunderstood. Means the way the information you have given, you must have given right information, but the receiver must have not received properly. So always see that repetition of whatever you have told, that you can do when you are talking to the non-medical person, so that you know that whatever information I have given, that is received in correct manner. That is very important. Then 10th, if you will see the limited resources, we always lack many of the material which has to be needed for the patient's safety, like gloves, plenty of gloves, dressing material, medications, many things. Even if you will see in the resources infrastructure. Now, if you see the older hospitals, when you go in the older hospital, the infrastructure is very negatively structured in today's century. Okay, that time it was fine, but today you have the fire alarm, you have the safety for the patients relative, every employee and employer both will be taking care of each and every person's safety. And the infrastructure also, if you see today, it is done such a way that there won't be any harm to any of them who are working or who are admitted in the hospitals or institutions. So limited resources. These are some of the very common, and you also will be knowing all these points. It is not new what I am telling, but these are the challenges or barriers for the safety. And if you will see the challenges to overcome, there are some 7 principal tips to implement for the patient safety in health organization. So if you will go through these tips also, and if you will understand what is the challenge, you can overcome that very well. So first, if you will see, establish a safety and health management system. So the assessment tool for hospitals. Now you need to prepare such as tools and give it to you, the people, maybe the patients' relatives or the staff working in that, and let them mark it, and you will understand what is the how the patient safety is maintained in that particular area. Occupational Safety and Health Administration suggests that care providers should formulate the guidelines that determine the enterprise safety and health management system performance. So how we are performing, whether we are considering the patient safety whenever we are giving care to the patient. That is very important. Then second tip is build a rapid response system. This is again, it has been developed team steps. If you will see those steps, you will see that assessment of status of the patient, team members, environment, and progress towards the goal. So if you will do the rapid response system, you will again get the data regarding the patient safety. Third is make sure that the employees know and understand the safety policies. This is very important, that everybody should know what is the policy in my institution, and that has to be followed. And every time you have to revise it, means again and again you have to implement that policy. You keep it on the make posters and put it in the any corridor, lift, or anywhere, and everybody should be aware about these policies, and so that the patient safety can be taken care. Then comes the develop a safety compliance plan. Of course, when you are going to do all this, you need to have a better plan in your hand. And this is compliance plan, because whatever you get the data from this through these assessment tools, what you have prepared, then you have to work on it, and you have to find out what all changes we can do accordingly, whatever data we have got, and make the changes there. Then fifth point is practice patient-centered care. We always say it is patient-centered care, but sometimes we find that अरे मेरा छुट्टी को 5 minutes है, and now the patient is coming from the OT, just look after it. I'm just moving. So it should not happen. You have to see that, okay, 15 minutes, let 10 minutes, I will be late for relieving, but let me hand over properly. Let me see whatever patient is having post-op care medications, and let me hand over properly. And then only I will be leaving the place from there. So always think of the patient first, and then whatever next is there. So today, however, you know that evidence-based treatment supporters view patient-centered care as a critical framework for establishing and promoting the desired wellness outcome. Again, here EBP is there, and you will see that the patient-centered practice is followed in your own institution. Tip 6 is communicate safety information to the patients. Again, here proper communication has to be given and make them aware about their own safety, own recovery, everything. Then next point is incorporate safe hospital designing. Just now I have discussed about this physical structure, olden age, and today's advanced hospital. I have heard that in global hospital, they have theater which doesn't have a single corner. I remember when we had a hospital, when I was working in 80s, the hospitals had a roof leak ho raha hai, somewhere you find that fungus is formed and all that was there. But today, now the advanced technology is there, the safe designing is done. And what I have heard, I have not seen, but in global hospital, they don't even have corners. It is right from the floor to the roof, they have plain carpet or whatever structure they must be having. So as the advancement is there, we need to see that the safe hospital designing also is there. So in that, you have to see not only the structural characteristics, but air quality, critical information, proximity, noise dampening, then standardized feature locations, then fixtures like contagion spreads, reduce how we can reduce it, then employee hand sinks. Now today's, you know, that pandemic, which will be my last topic, subtopic. Then COVID pandemic, how we are doing now, you must have seen, I have seen in the corridor, in out of the hospital also, there are basins kept for hand washing, sanitizers are placed. These all things you have to take care when you for the safe hospital design. Obviously, this all safe design is going to directly and indirectly take a part in the patient safety. So this all about how you are going to overcome and how you are going to face the challenges of patient safety. Now, last but not the least, as you know, now for last 2 years, we are facing this COVID pandemic, COVID-19. And that's why today I'm not with you, but I'm sitting at my home and I'm taking lecture and we are conducting webinars and all that. So that in that, if you will see COVID-19 and patient safety, the COVID-19 and human factors you have to see. I'm not going to go in depth. I'm just want to note it down. COVID-19 and health worker safety, very, very important. You must have heard that many of our warriors, the frontline workers, have lost their lives while working and serving for the COVID patient. So it is very important that we all have to take care of ourselves as a health worker, and whoever is working as a frontline worker has to be taken care of the safety. Then comes the evidence-based care. Of course, do the researches and find out the data and work on it. Then equity. You see that the person with economically, religious, or cried or craved, whatever is there, you please don't keep them away from getting the treatment. There has to be equitable distribution of the healthcare facilities to everyone. But you must have noticed in this COVID-19, the people who are economically not uh, well, they have suffered a lot. Uh, we have heard, everybody must be knowing that families have been destroyed, the small children has been dead. This is because of inequality that should not be done there. So everyone should get the equity because it is again the patient safety. Then diagnostic safety. It was on WhatsApp, I suppose, that one of the person who was supposed to do the RT-PCR, means throat swab he has to take, that person had taken a swab from genital region. Can you imagine? This is, I don't know what type of personality, I don't know, but diagnostic safety. The person, if you are educating the people, lay person also, they will be knowing what type of diagnosis I am going to do and how it must be done. So that all things we have to see. Country response, then collateral damage to the children, we have to take care. Collateral damage to other people also. Neonatal patient safety is also one of the part of this. Then emergency care safety, when the patient's CT score is high, the person oxygen saturation SpO2 is low, and the patient is having severe symptoms and all, that patient should get the priority and the bed and treatment and whatever is needed, remdesivir, and we know all the things in COVID. Then information technology, advanced information technology. Now this Navi Mumbai, then Panvel Municipal Corporation, they had an app also, and the information for the bed, availability of the oxygen cylinder, availability of the medication, everything you get on the WhatsApp. So that is very nice that this information technology has been used and utilized for the patient safety, patient's benefit. Long-term care, outpatient care, then patient and family center care, personal protective equipments. Of course, we know now for this pandemic and COVID-19 has taught us many things. This PPE, we were just teaching the students, downing, doffing, and all we were telling the students, but now we have seen that everyone had to utilize these PPE kits for their own safety as well as the patient safety. Then quality improvement, school responding, surge capacity caught by the police, that instead of vaccination, they had given just plain water and they have taken money from the public. So many things are there we have to take care of. Then survivorship is there, mortality, neonatal patient safety, pediatric patient safety. These all safety things are one of the challenges in COVID-19, where we have to teach the public, lay persons, how they can be safe wherever they go for the treatment. We have to tell, first of all, we have to see that which are the facilities available at particular hospitals. And I myself, you will not believe, but for last 2 years, I'm always going to the government hospital for the treatment. If I see, last week only I have done my RT-PCR, which is negative, but I go to the municipal corporation PSC, fever OPD, and I do my investigations and take the treatment from there only. So you need to tell the people where you are safe, where you will be in safe hands, and see that you think of all these things. Then general change in primary care, if you will see, because of pandemic, is the policies have impacted primary care at 3 levels. We know primary, secondary, and tertiary, and the patient's behavior, healthcare professional, and the overall work conditions with all interplay between these, which ultimately impact the quality and safety of the service delivery. So there are some changes taken place at primary care level, and it includes the community related risk for mental health. I had attended many webinars by TNA and all, and they have everyone has focused on the psychological aspect during this COVID-19. So we also need to take care of it for their own safety as well as family safety. Then challenges within the family. You know that many of us must have not gone out to meet our relatives even and family members because of our own and their safety. Quarantine associated risk, of course, focus on high risk children and domestic violence and child maltreatment. So these all aspects we have to consider in keeping in the view of the patient safety. Then there are 10 strategies to implement in healthcare system during COVID-19 pandemic. So I will just read and try to complete this last aspect, that is practical approach that can be used to protect the healthcare personnel, patients and communities. So as I said previously also, when you are taking care of patient, ultimately you are taking care of yourself also. So first, understand and execute the current infection prevention and control, then practices for COVID-19. Teach them why the mask has to be put, how the mask has to be put. Because today when I go out, I see that everybody is putting mask, but it is just covering this, nose is open. So these facts you have to tell them to make them understand. Develop protocols for HCP to monitor themselves for fever and symptoms of COVID-19, restrict them from work and give them this sick leave or post exposure. Previously, means continuously, if you see, government was changing the protocols. Initially, it was 1 week they will be working in the COVID, then 1 week they will be taking rest, then 1 week they will be working in the non-COVID region and all. So many protocols had come. According to protocols or as per the need and the severity of the sickness, we have to take care that the healthcare workers also are being taken care of for their own safety. Then third strategy, if you'll see, establish a plan for providing additional support for HCP and considering aspects such as mental health. Again, we have said parenting, meals, and non-punitive sick policies also. Help your HCP become well versed in evidence-based care of patients with COVID-19, including the guidance provided by WHO and Surviving Sepsis campaign too. Then understand the guidance for discharging a patient with suspected or confirmed COVID-19 from the hospital to home or to a long-term care facility. We know that RT-PCR is the best way to do for confirmation of your COVID-19, whether you are positive or negative. The symptoms just cannot be given any surety. The telehealth strategies when feasible to provide high quality patient care and reduce the risk of COVID-19. So we already know that telemedicines and these things is given. So you can give the consultation. Now, many of the doctors also have started with a teleconsultation so that exposure is reduced and the safety is given to the patient as well as the healthcare providers also. Maintain awareness of the COVID-19 situation in the state, city, and facility wherever you are providing, because as I know, MGM also was a COVID hospital and many hospitals had made it as a only COVID. Then slowly now as the number of cases are reducing, every hospital is coming back to their normal this thing. Uh, so this thing next is report hospital capacity data to HSS and protect using one of the approved mechanisms to describe in the HSS COVID-19 guidance and hospital reporting and FAQs. So give whatever data you have, be very clear whatever data you have given, don't hide anything. So that all is very important to understand exactly the severeness or emergency in this COVID situation. Then the strengthen your facilities response mechanism by becoming familiar and pandemic, specifically in COVID-19, because this thing response mechanism, you have a feedback and let the people give you the feedback. The institutions become more panic because if they get the negative feedback, they feel that the patients will, the patients will not come back to them. But of course, the administrative people can work on this negative feedback and try to give better facilities and take care of the patient safety also. Then last, that is 10th point, strategies develop and maintain a communication plan for your HCP patients and the community. Consider including virtual town halls, daily hurdles with local leadership, calls with partners, emails and phone conferences for the staff, media, benefits, briefs and the others. So communication channel is very important to provide the patient safety and give the proper care in during this pandemic. So it is very important that there are many strategies that have been developed during pandemic, for pandemic, as well as for the routine also. So to conclude, I will say that this thing, you take care, all the strategies, try to follow these strategies, work on it, plan properly, be a team and work as a team member, support each other, cooperate each other, and whatever you are doing, keep the patient in the middle, in the core, and think of their safety. And you can do it. I am sure about it. So be patient. Take home message for you all, specifically students. Be patient with patients who are not patient. Did you understand? Yes? Hello. Are you there with me?
Yes, ma'am.
Yes, ma'am. Yes.
Yes. Okay. So here I'm finishing my topic. Any queries, anything you have, please let me know. One sec. How I have to come back now that I'm not getting. How I should come back now? This I should close now. Neha, just a minute. I'll just see. Okay.
Ma'am, you can click on leave. Can you hear me?
Suparna ma'am, you're muted.
Radha,
We can't hear you, ma'am. We are
Radha, you can hear me?
Yeah, sorry. I'll repeat now and thank you. Please give my regards to Prabha Desilla ma'am. Susan, thank you for inviting me here. Parganzia, then Nair, this one Sarika Nair, and all MSc students. Thank you very much. Okay.
Ma'am,
Yes.
ma'am, can you hear me?
Yes, yes. It was breaking in between. Yes. Yes, please.
Now, can you hear me?
Yes, yes, I
Okay.
can
I
hear
take
you.
this opportunity to you, ma'am, to be a resource person for today's webinar.
Uh,
Even though if you are busy schedule, you have given the consent with a short notice, and you have really oriented all of us to the various emerged barriers, challenges to improve patient safety. Ma'am, you have emphasized even to incorporate this patient safety in the curriculum.
yes.
We would definitely do it.
Yes, we
Actually,
should do all
patient safety
together.
is not there much. Yes,
Yeah,
yes, yes.
yes.
So,
I'm
and
really,
thank you, ma'am, for once again you
I'm really thank you that I
have
have started my career from MGM only. This one,
okay.
Sudhir
Thank
sir only
you,
had
ma'am.
taken my interview initially. Sudhir sir, Sudhir Kadam.
Okay, ma'am.
And then after
So, thank
leaving
you, ma'am,
Bombay
for your
Hospital, yes. Susan, bye.
for your,
Okay.
yes, ma'am. Thank you. Thank you,
Please
ma'am.
send my this thing,
What is the
certificate,
item?
mail me. I have to
Yes, ma'am. Yes, we will send you, ma'am.
yeah, submit to office.
Yes, ma'am.
Okay.
Sure, sure. We'll send you.
Okay. Can I make a move?
Yes, ma'am. Thank you. Thank you so much.
Okay. Thank you. And all the best to all the students. Yes.
Thank you.
Okay. Thank you.
Over to Zaida. Zaida. Zaida.
Thank you, ma'am. Thank you so much, ma'am, Suparna Patil, ma'am, for sharing your valuable information with us. Now, the next dignitary to honor us with her presence is Dr. Jyoti Milind Chaudhary, ma'am. She is Associate Professor from Research and Innovation Coordinator. Her professional qualification
Sindhu, you
is
wanted to tell something?
BSc Nursing from LT College of Nursing, Mumbai in 1997. Then she has completed her MSc Nursing in Community Health Nursing from LT College of Nursing in 2001. Then she has pursued her PhD Nursing from MGM Institute of Health Science, Kamote in 2009. That I would like to welcome ma'am.
Hello. Thank you, Arpita. Actually, last session has some advantage. Advantage in the sense, up till now, whatever has done, most of the topics are covered. So you don't have to spend much of your energy. Disadvantage that everything is covered now, what is remaining. But still, I will make sure that we will stick to our topic and the time. So these are the these are the objectives of the session. So mainly we are going to see what is the role of the health team in the patient safety. Now, when we say patient safety, already the things are done. It is a discipline in the healthcare sector that applies safety science toward the goal of achieving a trustworthy system of healthcare. So two important ones, safety science methods and trustworthy system of healthcare delivery. Now here patient safety is also an attribute of the healthcare system. So what we are going to see in the healthcare system, we require team to function the healthcare delivery system. So together everyone achieve more, which we all of us know. So let us see who is our team. We have nurses, doctors, microbiologists, physiotherapists, psychologists, biomedical personnel, primary care supporter, pharmacists. But more important, the caregiver of the patient and patient themselves are also a part of the team. Because of them only, we will be able to achieve the objectives of the patient care or patient safety, because it is for them. So what are the types of different teams are there? So basically it is divided into the 6. First team is the core team, which is a unit based, like they are at the patient's unit side. So physician, nurses, physiotherapists, pharmacists, who's directly involved. Now, if you see in our hospital, we don't have a pharmacist who's coming and prescribing the medicines around. Yes, but physician, nurses, physiotherapists, we are directly giving care, giving treatment, following the treatment protocol. So we are a core team. Second is the coordinating team. He's responsible for day-to-day operational management, coordination functions, resource management of the core team. So whatever the resources are required, which will be provided either by the board in charges, supervisors, head of the department, quality sale, infection control process. So they are the core team. They coordinate and make sure that the day-to-day operations are done. Third team is the contingency team. They are specifically for specific event. Like for example, some disaster happens, some cardiac arrest happens. So there is a code blue and the code blue team gets activated. They are from different they are working in a different settings on different positions and level. But during the specific event, they come together and they respond. So that is a contingency team. Fourth important one, that is administration, which is accountable 24/7, and it shapes the climate and culture of the teamwork. So here administrators like medical superintendent, nursing superintendent, and there are many administrative heads are there, including HR and other people also. But HR is not directly responsible for patient safety. Of course, for staff recruitment and other things, they are responsible. So how administration team works and how? So by establishing and communicating the vision to the subordinates, to the healthcare team members, developing and enforcing the policies, setting expectations for the staff, providing necessary resources for successful implementation. Whatever they want, the committee can tell, and they have to make sure that the resources are made them available. Holding the teams accountable for team performance. It is not only giving the responsibility, but making them accountable so that we can expect certain changes, we can expect some better outcome. Defining the culture of the organization. Okay, what is the culture of the organization? When we say patient safety, patient is the priority, or safety of the patient is the priority. Then we are an ancillary services team. So which consists of the individuals which provide direct or task-specific time-limited care to the patient. Now they can be the cleaners, domestic staff, catering staff, linen department, like so on and so forth. So they are basically primarily a service delivery team, which may not be situated in a particular unit or particular ward, but they are catering the services to all. Then we have support services, like they are very much service focused or integral members of the team, like maintenance department, biomedical engineering department, infection control department. So which makes sure that the clean environment is maintained, the experience of the patients are enriched because of that. Even the security personnel also can include it. So we know whenever there is a team, there are stages of team development, which you are already learned in the group dynamics, either in the CT or psychology. That is forming, storming, norming, and performance. So first you form, you are in the ambiguous confusion state, but you come together, you communicate. Storming phase, difficult state, conflicts may happen, you get frustration, there will be power position issue. Norming, you communicate with the team and you develop a cohesiveness. Okay, everybody accept, you follow the procedures, communication pattern. And performance, you work towards the goal, perform the task to achieve the goal. So now here you are very much trustworthy, you are very much cooperative, resourceful, and so on. Next is what are the outcomes? So outcomes of the outcome measures for effective teamwork. So they are like organizational benefit, team benefit, or individual benefit. Organization, why we want patient safety? We want to reduce hospitalization time and cost, so the more and more beds will be available for others. Efficient use of healthcare services, enhanced communication and professional development. How it will benefit the team? So improve coordination of care. It will benefit the patient because satisfaction will be there, and for team they will feel that there is a job satisfaction, and reduce unanticipated admissions. Like we say within 24 hours or 72 hours of discharge, patient is readmitted. So that will not happen, and actually your patient safety indicators or quality indicators will. Efficient use of healthcare services, the acceptance of the treatment, that is a benefit for the team. And when there is acceptance, greater role clarity will be there for the patient and better accessibility for the patient. So like that, outcome measures are there for the safety. So what are the characteristics of successful team? So they are having some essential characteristics, and there are some other, like everybody should have a common purpose. The team has measurable goals. You can measure in terms of like infection control rate, surgical site infection control rate is 20% or 5%, and within 3 to 4 months or 6 at the end of 6 months with the certain policies, protocols, and resources, it will reduce to 3% or maybe for 5%. So measurable goals. Effective leadership is also important, because when you want to say a health, whenever there is a team, somebody has to have a leadership which is given like a formal leadership, or at times situational leadership is also required. So you should be very assertive. Effective communication is one of the characteristics of the team. Good cohesion, like understanding should be there, trust development should be there, confidence should be there. Then only you can, it is possible that team can work, and team will have only one say, or we can say one voice. Mutual respect, this is also very important. Another person may have some different perspective, and you may have different perspective, but you have to give a mutual respect and understand in what context and in what situation he has told. So whether we can adapt or not. So that kind of mutual respect is one of the characteristics of the team. Others are like demonstrating individual task proficiency, like whatever task is there as an infection controller, as a microbiologist, or as a leadership person, communication person, you will have a particular proficiencies or technical skill. Having task motivation, you should be highly motivated, at the same time flexible to solve the issues, monitoring their own performance, that is self-evaluation. You have to do after each and every day, or you can say after each and every event, like why this has happened and how this has happened and what we can do best. Effectively resolving and learning from conflict, and demonstrating situation monitoring. So these are the different characteristics one should have. Now, we have already learned there are safety competencies, patient safety goals we have learned. Madam Suparna has also told WHO related and joint communication related safety goals. So basically these safety goals are divided into the 6 domains, not safety goals, the competencies which require for the health team member for effective patient, for achieving the effective patient safety goals. They are divided into 6 domains, 3 competencies and 140 enabling competencies. So as a team, we must know that these domains and these competencies, we know it better. So first is works in team. So we should know like what we have learned, how team is formed, what are the different characteristics of the different people. Then communicate effectively, manage safety risk, optimize human and environmental factors, recognize, respond to disclose adverse event, and contribute to culture patient safety. We'll see in detail. There are 3 key areas where these competencies are related. So basically, this is the science of patient safety. We have to develop our competencies to see the patient safety as a science. Then methodology needed to carry out the patient safety research. That is the second area. And third one is the KT, knowledge transmission. Now this knowledge transmission word is very common in the IT industry. We don't use it much, but eventually we have also started using. So what is basically it means? It is a like how to utilize research policy to change to improve the patient safety. So you train the people to utilize the patient safety knowledge. So here we are saying about the utilize the research policy so that we'll have a evidence-based practice in the patient safety. Now, what are the contributes to culture of patient safety, which is already discussed by Suparna madam and Padmaja madam. So encourage team members to speak up. Don't say ki it is not your domain. We will see infection control department will see. No. Encourage teams to speak up. Patient safety issues and whatever the risks is there. Develop the patient safety first strategy over who is right or wrong. Okay, this is the very, it is an important mantra we can say in the culture of the patient safety. Next is the communicating effectively. So it is with the patient, with the relatives, within the health team member. So there are usually 4 communication styles we use at the workplace, even in the hospital or in area organization, you can say. So like active, logical, thinker, connector, and so depending upon the context, you may be very active. Situational leadership you have to be very active. Logical, when you have already identified the problems and it requires long-term management, so you have to have a logical framework and logical communication style. Connector, where more of coordination is required, so you have to be approachable, empathetic, intuitive, little bit of understanding the feelings of the patient and the individual health team member. So like that. Then thinker, where you are looking at the event or looking at the patient safety objectively without putting anybody as a problem creator or anybody as a fault finder. So seek the data and the facts in what context, why this has happened and like that. So your communication is like a thinker. So what are the communication techniques for the healthcare team, which you have learned? These techniques you have learned in the patient management under the nursing management, SBAR, call out, check back, and handover, which is very much needed in the patient safety. So like SBAR, that is you are telling the situation of the patient. I'm concerned about blood pressure or which is high. Background up till now, what has been, why patient has came, what is the other status of the patient. Assessment, whatever you think the problem is, the problem seems to be cardiac arrest or so. As per the assessment, what you think, what is the problem. Then recommendation, I suggest or request you, this will be your terms of a recommendation. So when you are giving the information from you to another person, you have to make sure that all the information of the patient should be given so that there should not be any error in the patient care. Similarly, call out. Now this is done during the critical information, like there is a code blue or code red, code purple, so many codes are there. So during that, team gets activated and then everybody knows what tasks they have to perform. So the technique helps the team members to anticipate the next stage and directs the responsibility. So as a first responder, as a second responder, performing their tasks during the code while giving the cardiac shots, call out. Okay. So this is another strategy, another technique. Then check back technique. This we use usually when there is a verbal orders are given by the doctors or by any competent authority. Check back what other person has said. Again, you repeat and make sure that that person say that it is true, or he may rectify it. Handoff. Now, what is this handoff? Give I pass the baton. So from my hand, I'm giving to your hand, like which is there in the relay. So introduction of the patient. Sorry, introduction. Then a patient name identifiers and assessing the patient's complaints, diagnosis, and situation. Now this we have already, some of the things we have learned in the SBAR also. Here what is about the time. So level of urgency or explicit timing which is required. That also you have to tell that immediately this has to be done or within 2 hours it has to be done. I'm going, but it has to be done. So ownership, who is responsible, who has to do it, or who has to take the decision, that or so those kind of things also needs to be communicated. And what will happen next? What are the anticipated changes, or what is the plan? That is the next. So when you give hand off and somebody is receiving the hand over, these points needs to be incorporated for effective communication. Now, next important point is resolving the conflict and the disagreement. So the simplest one is the Q. Q is a shorthand for 3-step process in assessing people in the stopping the activity. Like you have seen something which you feel that it is not good. So say firmly, I'm concerned, I'm uncomfortable looking whatever is happening. This is a safety issue and we need to tackle it. So please stop it. Whatever you are doing, it is not the right thing. Second is the second method is to challenge. So here there are 2 steps are there. How you say stop. Okay. So like voice out or concern at least 2 times as a time. You have to tell very confidently that please stop it. Member being challenged must acknowledge. So they have to acknowledge, okay, why she's saying things. If suppose somebody is not acknowledging you, then you have to go for the second step. That is, if outcome is not acceptable or they are not reacting, then take a stronger course of action. And here you have to use a chain of command to inform to the higher authority, being assertive, and maybe you have to do a little paperwork also, no problem, but you have to. So this is in a 2-step, we are challenging them first, where he has to acknowledge and he has to accept that he'll be taking some action. And the second one is when he's not accepting or no outcome is there, then you have to go to the higher authorities by using the chain of command. Now the third method is DSC script. So that is a constructive approach for resolving the conflict. So describe the specific situation, that is when you have seen or when this has happened. Express your concerns about the action, like I feel. Okay. Then suggest other alternatives. I suggest this can be done or that can be done. Then consequences should be set. If not done, what are the consequences? What are the adverse events to the patient, to the health personnel, like legal actions can be there, and even to the hospital and hospital indicators or name and fame. Now, barriers of effective teamwork. Now, in the last class, somebody has told about the barriers in patient safety. So, is it going to be something different? Not much different. But here I want to say particularly related to health team. So, changing roles of the health team member. You are having a team, and in that team there are different representatives are there, different people are there from different departments, and then at times their role gets changed. And when their roles get same, new members comes in, and it takes time for them to get access. Then changing the settings. Today you are in one ward or on one floor, and tomorrow you are in another area. Medical hierarchies, like we say, so many people are there, health team members are there. So sometimes there are hierarchical issues may also be there, and which can also affect your teamwork. Individualistic nature of medicine or care, like you cannot be always sure that this is only the correct. Okay, all patients cannot have the same thing. So that is the individualistic nature, and sometimes it affects. Then instability of the teams, like many times teams are dismantled and again new teams are made, the members are changed, and other barriers like roles are not being very clearly defined. Yes, we are there in the infection control team or quality control team, but what microbiologists will do or what CSSD department will do, what the infection control nurse will do, what the in charges will, roles are not very clearly defined. Lack of explicit coordination between all the members, that is also one of the barrier. Miscommunication or wrong communication is also one of the barrier. Now, another important aspect in that 6 competencies we are seeing, that is the team performance. So assessing the performance of the team is very important for improving the team performance. So we have to assess either the individual performance within the team or as a team. Okay, so when we say as a team, we are in the patient safety goal. So against that goals, we can say when the scheme started working and what was the baseline data under each safety domain, and at the end of the 1 year of efforts of the team, what is the data, or what is the characters, what are the goals we are achieving. So that is how we can assess, or we can assess the individualized performance of the organization. So nursing audit, safety audit, these are the certain methods by which you can assess the performance of the team. Now, what is the role of health team? In short, we have started with this. So, develop the health system for the patient safety. So, what is the mean by health system? The system has everybody's role, how to do it, so that the framework you are having, then you are having the policies and protocols, and how to implement it at what time and all. So this type of availability of the things is that is the system. So form the team and train the team, that is knowledge transfer and research in the patient safety related domain. So train the team. Perform safety competencies assessment of the health team. Monitor and support the needs of the health team for the patient safety and respond to the errors, negligence, or breach in due. This is very important. Develop policies and protocols which comes into the health system itself. Then perform safety drill and safety audit regularly, so that the health team is always remains activated, and because of the health team, all the core team, coordinating teams are also activated. Encourage team to conduct a research or evidence-based practice in the patient safety and resolve the conflicts and issues related to patient safety. So this is about the role of the health team. So what we have learned in this, what we have covered up till now, the teamwork does not just happen. It requires an understanding of the characteristics of successful team, knowledge of how team function, and ways to maintain the effective team function. There are a variety of team tools that have been developed to promote team communication and performance, and these include SBAR, call out, check back, I pass the button, which you have to use it. So for the student, what is the message? Use the teamwork principles when you are a part of the health team, and whether you are a student, whether you are a nurse, you are a part of the team. Be mindful of how one's values and assumptions affect interactions with the other team members. So please be careful. Be mindful of the role of the team members and how psychological factors affect team interactions. Recognize the impact of change on team members. So that is also very important. We have to consider the team members and give them time to react and respond. Be mindful of the role of the team members and how psychological factors affect the team interaction. Recognize the impact of change on team members, so that you can be a good team member. Use mutual support techniques and resolve the conflict. Use communication techniques and observe the behaviors of the team, how they work effectively. So this is a short message, or I can say take a message from my class on role of health team members for effective patient safety. So I will say thank you over here. This is a short and script. I think if anybody has any doubts, I love to answer, but I know there is a time is up and anybody wants to go back. But still, if there are any questions, I'll take. There are some references. Actually, many more are there, but because of short of time, I didn't include them.
Thank you, Dr. Chaudhary, ma'am. Here I would like to call my colleague, Mahima Yadav, for vote of thanks. Good evening, everyone. On the behalf of MGM New Bombay College of Nursing, I take this opportunity to propose vote of thanks to those who have directly and indirectly contributed to the successful webinar on patient safety highest priority, organized by first year MSc Nursing students. Then, at the outset of, I thank our resource person, Mrs. Padmaja Dhavde ma'am, Associate Professor and Nursing Superintendent, MGM Hospital Mothe, Mrs. Sarita Sukesh Nayak ma'am, tutor of MGM New Bombay College of Nursing, Mrs. Suparna Patil, Principal of BID Center, Panvel, and Dr. Jyoti Chaudhary ma'am, Associate Professor cum Research and Innovation Coordinator of MGM New Bombay College of Nursing. We are really enlightened with our knowledge and presence. We thank you heartily for sparing your precious time for us. We are thankful to our director, Dr. Prabhakar Dasila, for her constant support and motivation. I would like to thank our Vice Principal, Dr. R. Ponchitra, and our PG Coordinator, Mrs. Susan Jacob ma'am, Professor of MGM New Bombay College of Nursing, for their enthusiastic support and guidance in organizing this webinar. A special thanks to our Hospital Coordinator, Mrs. Preeti Matthew Mariam ma'am, Associate Professor of MGM New Bombay College of Nursing, Organizing Committee, teaching and non-teaching staff for their unflinching support. And a special thanks to our Farganzia ma'am, Assistant Professor of MGM New Bombay College of Nursing, for helping us and preparing us to make this webinar successful. Our heartfelt thanks to our students for active participation. With these warm words and a kind message, we move to the end of today's webinar. Thank you. Kindly fill the feedback link in the chat box for availing e-certificates. Thank you so much.
Thank you all participants. And also I would like to congratulate my MSc first year students for successful organization of this webinar. Thank you all of you. You can leave now. Please fill the feedback form before leaving. Thank you.